Hello students, in today's video we will discuss about the sphenoid bone. So we will discuss the sphenoid bone in multiple lectures because you know that it is a very long topic, so we will not able to finish it in a single lecture. So when you will see the sphenoid bone, what are the important parts you should know when you hold the bone in your hand? So this is having a central body. It is having the four wings and it is having the two pterygoid processes. Now, when you will see this bone resembles like a bat. So, when you will see the bat, it is the body and these are the wings of the bat and they are legs of the bat. So, it is having one lesser wing on the upper part and these are the side greater wings and these are the two pterygoid processes, and every process is having two plates. This is the lateral plate, this is the medial plate. So what are the parts of a sphenoid bone? Body, lesser wings, greater wings, pterygoid processes, and every pterygoid process is having medial plate and lateral plate. Clear? Now when you will have the sphenoid in your hand, you should have the idea that this sphenoid, when you will see articulated skull, is going to make a joint with the 8 bones. And when you will see the open skull, you will realize that it is a middle bone of the skull, and that's why it is known as key bone of the cranial skeleton. See, this is again a small MCQ for you, which is a key bone of your this cranial cavity. So that is the sphenoid bone, and it is going to articulate with how many bones? Answer is 8 bones. So what are the name of these 8 bones? So these are the name of 8 bones: frontal, parietal, temporal, occipital, vomer, zygomatic, palatine and ethmoid bone. So how it is going to make a joint? For that we will see this small video clip here, that when you will see the bone, this is your sphenoid. Now in the normal lateralis, you can see it is making a joint with the frontal, parietal, temporal, but when you will see the zygomatic bone, it is not seen here to making a joint, but when you will rotate, you will see inside this temporal fossa anteriorly, it is articulating with the your greater wing of sphenoid. So these are the 1, 2, 3, 4 bones which have direct articulation on the outer side. Now for the other bones, we have removed this side of maxilla, and now you can see this is the palatine bone. And this palatine bone is making a joint here with the pterygoid process, and this is a 5th bone. So this is your palatine bone which is articulating with the your sphenoid bone. Now when you will see the cranial cavity, anterior cranial fossa, you will find that this is the sphenoid bone which is anteriorly articulating with the ethmoid bone. So this is the articulation here. Now there is a one more articulation which is here is the vomer bone. Now this vomer bone is making a joint with the rostrum. Clear? So this is one bone, and you have the articulation with the occipital bone which is your clivus. We will see the clivus. So that is your articulation on the posterior side. So in this way you can see that it is making a joint with the frontal, parietal, temporal, occipital, vomer, zygomatic, palatine and ethmoid bone. Clear? Now we will move to the next part of this session, that when you will have the bone in your hand, and if you will see the body is a 6 surfaces area. It is like a box. So it is having anterior surface, posterior surface, superior surface, inferior surface and 2 lateral sides. So these are the 6 surfaces of the body of sphenoid bone. This is the superior surface, that is the inferior surface, anterior surface, this is the posterior surface and 2 side surfaces. Clear? Now body also contains a pair of sphenoidal air sinuses, because sphenoid is also a pneumatic bone. So in the center of this body you will find the air sinuses inside the sphenoid bone. Clear? So now we will move to the one surface, and that is the superior surface. So in today's session, I will only discuss about the superior surface of the sphenoid bone. Now to see the superior surface, we are actually talking about the floor of cranial cavity. So this is the floor of cranial cavity, and you know that this cranial cavity divided into the three part: anterior, middle and posterior cranial fossa. Now this sphenoid bone is articulating, or you can say participating into the anterior as well as middle cranial fossa, which is important concept to understand. Now here in this diagram, what you are able to understand that this is a midline structure. You know that here you will have a frontal crest, then you will have the crista galli, and on the both side you will have a perforated area is known as cribriform plate. This cribriform plate is a part of ethmoid bone, and when you will go posteriorly, now here you will have the lesser wings of the sphenoid bone. These are the lesser wings of the sphenoid bone. Now this posterior margin of the lesser wing is actually the posterior border of this area, which is known as anterior cranial fossa. Now behind this margin, the remaining area till this upper border of part of temporal bone is the middle cranial fossa. So we will see that this is our sphenoid bone, the body is here, the lesser wings are here and the greater wing is here. So this area is in the middle cranial fossa and this area is anterior cranial fossa. Clear? So whenever you are talking about the superior surface, basically you are seeing the sphenoid through the cranial cavity, and in this midline, what are the important features are seen on the superior surface of body, we are going to discuss. We will not discussing the side part of the greater wings of the sphenoid. This part we are going to discuss in this session. So what are the structures you are able to see in the midline particularly? So first is the ethmoidal spine that I will tell you. Then behind the spine you will have the flat area is known as Jugum Sphenoidale. Then you will have sulcus chiasmaticus. Then you will have Sella Turcica. This Sella Turcica is having three components from anterior to posterior: tuberculum sellae. Then you will have hypophyseal fossa. Then you will have dorsum sellae. And behind that you will have the posterior clinoid process and Clivus. Now behind the Clivus, now if you will see this slope area, now this slope area is known as Clivus. Now where is the Clivus? Now if you will see the Clivus is this sloped area which is directed towards the foramen magnum. Now this Clivus in upper part contributed by the body of sphenoid posterior area, and the remaining part is formed by this inner side of basi occiput, and this whole is related with the pons. This area is related with the pons. So we will see the Clivus, which is the most posterior part of the sphenoid. So in midline you first have this idea that only when we will start from this point to this point of the sphenoid bone, what are the structures you are going to see in the midline. So again here we will have the crest of the sphenoid bone, which is known as ethmoidal spine, because it is going to make a joint with the ethmoid bone. Then we will have this flat area is known as Jugum Sphenoidale. Then you will have sulcus chiasmaticus. Then you will have this area which is having a single name is known as Sella Turcica, which is having three components. Then you will have the posterior clinoid process and this upper area of Clivus. So now we will discuss these area in midline one by one. So here if you will see the cranial cavity, we are removing the frontal bone. So we have removed the frontal bone. Now inside that you can see this is your inner side of the cranial cavity, where you are able to see the superior surface of the sphenoid bone. So now here you can see that this is a projection, and this projection is making a joint with the ethmoid, so that's why it is known as ethmoidal spine. Then this flat area which is known as Jugum Sphenoidale, behind that you will have this area is known as Sella Turcica, and posteriorly you will have the Clivus, where we are going to make a joint with the basi occiput. Clear? Now we will move to the features of Jugum Sphenoidale first. Now when you will see the Jugum Sphenoidale, the most important thing is that this is the Jugum Sphenoidale, which is a part of anterior cranial fossa. It is in the floor of anterior cranial fossa. So this is the one thing. Second thing is that anteriorly it is articulated with the cribriform plate. So here I told you that this is the cribriform plate and this is the articulation with this middle portion of your ethmoid bone. So in the center you will have a spine, plus here you will have a cribriform plate. And on the side there is a one more joint is forming, and that is with the posterior margin of these orbital plates of frontal bone. So this is also you can appreciate here. So this is the area which is your part, and this area is known as Jugum Sphenoidale, which is a flattened area, and this Jugum Sphenoidale is present into the anterior cranial fossa. This is the one thing. Second thing is that this is making a joint with the cribriform plate plus this posterior margins of the orbital plate of frontal bone. Apart from that, posteriorly, this Jugum Sphenoidale is limited by sulcus, is known as sulcus chiasmaticus. So where is the sulcus chiasmaticus? Now this is the sulcus chiasmaticus. Now this sulcus chiasmaticus is basically the posterior limit of Jugum Sphenoidale. It forms the roof of sphenoidal air sinuses. What is the meaning? That if you will see this area, you will find that deep to that we will have the sinuses. What we will have? Deep to that, sinuses. So if you will break this area, you will find the spaces which is known as sphenoidal air sinus. And apart from that, this area is related with the olfactory tract and gyrus rectus. So how this relation will take place, I will show you. So these are the two images. This is the image of your these videos, and this is the actual image. Now if you will compare both these diagram, in the actual this specimen, you are able to see that this is your sulcus chiasmaticus, this is your Jugum Sphenoidale, and this Jugum Sphenoidale is here making joint with this cribriform plate posterior area. Now here you can visualize it. Now here this is your sulcus chiasmaticus. Now here this is your cribriform plate, and this is the ethmoidal spine, and this is a joint here with the cribriform plate, and also on this side you will have the orbital plate of frontal bone that will come and making a joint with this part. Clear? So this is the Jugum Sphenoidale. Now here what you are able to understand, that from this cribriform plate what will happen, that olfactory nerves are entering into the anterior cranial fossa. Now these olfactory nerves received by a dilated area is known as olfactory bulb, and from the bulb you will have the origin of olfactory tract. Now this olfactory tract, here you can see that it is passing posteriorly on this Jugum Sphenoidale. So Jugum Sphenoidale is related with the olfactory tract. Now above that you are able to see this is the inferior border of your cerebral cortex. Now this is the medial surface of the cerebral cortex. This is the inferior border of the cerebral cortex on the medial side, and this area is known as gyrus rectus. This medial most gyrus along the medial border on the inferior aspect is known as gyrus rectus, which also lies just above the Jugum Sphenoidale. So that's why it is written here that Jugum Sphenoidale related with the olfactory tract and gyrus rectus. Clear? Now we'll move to the next part, is sulcus chiasmaticus. Now how to identify the sulcus chiasmaticus? So it is easy to identify because sulcus chiasmaticus is basically continue on both sides with the optic canals. So where it is present? It is present into the middle cranial fossa. That you can see in this image, that this is the sulcus chiasmaticus. Now sulcus chiasmaticus is a part of middle cranial fossa, and both the ends of this sulcus chiasmaticus laterally continue into your optic canals. Then, so it demarcates the anterior border of posterior border of anterior cranial fossa. So it demarcates the posterior border of anterior cranial fossa. So this anterior cranial fossa will end here, that is on the sulcus chiasmaticus. It is having a transverse groove just behind the Jugum Sphenoidale, and it is continued laterally in the optic canals, and the optic chiasma lies above it. Now why I make it bold? Because the chiasma does not lies inside the sulcus, it lies above the sulcus. Clear? So this area related with the optic chiasma, because optic chiasma lies above the sulcus, not in the sulcus. So here you can see that this is your sulcus. Now here you can see this area is the sulcus, and when you will trace it on the side, you can see that these are the two optic canals where you will have the optic nerves. So when you will see from the posterior side, you are able to appreciate this sulcus chiasmaticus. And how to identify the sulcus chiasmaticus? It on both the side continue with a canal is known as optic canal. And this flat area which is anterior to this sulcus is known as Jugum Sphenoidale. Clear? Now there is a third term in the midline is Sella Turcica. Now what do you mean by Sella Turcica? Sella Turcica word comes from Turkish saddle. Now what do you mean by this saddle? Saddle is this type of structure which is used to put on the back of the horse while you are doing the horse riding. So there is a depression in the middle area so that it will accommodate you. So this is the middle area where it accommodate you, and it is having the anterior posterior projection. This anterior projection is here to hold, and this posterior projection is here on your back, and it provide support and avoid the posterior slipping. So this is known as Turkish saddle, and it is known as Sella Turcica. Now same appearance is visible here in this section. Now if you will sagittally cut the bone, you are able to see that this is the depression in the midline. Now this depression is here. This depression accommodate the pituitary gland here. Clear? Now then there are two projections, one is more prominent, one is less prominent. So this is one prominent, which is the posterior part, and this is the anterior part. So this whole area is resembling this structure, and this area is single word we are using is Sella Turcica. So Sella Turcica word is a combination of three terminology. What are these three terminology? Tuberculum sellae, hypophyseal fossa, and dorsum sellae. So tuberculum sellae is anterior border. Now this is the anterior border which is known as tuberculum sellae. This middle is known as hypophyseal fossa for pituitary gland, and this posterior is known as dorsum sellae, and all these three are having a single name Sella Turcica. Clear? So now what is tuberculum sellae? Tuberculum sellae is just an elevation behind the sulcus chiasmaticus. So I told you that this is your optic foramen or optic canal, and we will have both the side. This is a section. So this small portion you are able to see, this is the sulcus chiasmaticus. Now behind the sulcus chiasmaticus you are able to see a small projection. Now this longitudinal horizontal projection is known as tuberculum sellae. Now behind this tuberculum you will have this depression for the pituitary gland, that is known as hypophyseal fossa, and behind the fossa again you will have a bony plate here, and this bony plate is known as dorsum sellae. Clear? So what is tuberculum sellae? It is a small elevation anteriorly, then hypophyseal fossa, and then dorsum sellae. Clear? So here in this image you can see that this projection is tuberculum sellae, this bony plate is dorsum sellae, and this middle fossa is hypophyseal fossa, and this whole area is known as Sella Turcica. Clear? Now the important thing is that when you will see the tuberculum sellae, the ends of this tuberculum is known as middle clinoid process. What they are known as middle clinoid process. Then when you will have the dorsum sellae, which is a square plate, the ends of this dorsum sellae are known as posterior clinoid process. So here you can see that these 2 points are known as middle clinoid process. Where is the middle clinoid process? These are the middle clinoid process and these are the posterior clinoid process. Clear? And these are the anterior clinoid process, which are the sharp projections of the medial end of lesser wing. So these are the anterior clinoid process, these are the middle clinoid process, these are the posterior clinoid process. Clear? Now, in this X-ray, sometimes you have this such lateral view of the skull. Now here, if you will zoom and very clearly you can see that this is the fossa. Now this is the floor of your cranial cavity, and here you can see this depression which is known as pituitary fossa, and behind that you can see this bony projection. Now what is this? This is the posterior part of the Sella Turcica, that is dorsum sellae, and this is the anterior projection is your tuberculum sellae. So this whole area is known as Sella Turcica. So this is the view which you can appreciate in the lateral X-rays. Now there is a very important term comes here, is known as Carotidoclinoid ligament. Carotidoclinoid ligament. Now what is this? It is a connection. It is a connection between the anterior and middle clinoid process. So this is your anterior clinoid process. This is your tuberculum sella, and here will come its middle clinoid process. So between them you will have a connection. Now here you will have a connection, and this connection is known as carotidoclinoid. Now why the carotid word comes? Because this upturn of internal carotid artery, this upturn of internal carotid artery is passing through this area, and this upturn is known as siphon. This upturn is known as siphon, carotid siphon. So this carotid upturn or carotid siphon is passing through behind this ligament, and sometimes this ligament is get ossified and convert this area into a small foramen. So this is an important thing to understand, that when you will have this carotidoclinoid ligament, where it is present, it is actually the area between the anterior clinoid process and middle clinoid process, which accommodate this upturn of internal carotid artery. Clear? Now we'll move to the one more word. Here is diaphragma sella. So there are 3 sellae, tuberculum sellae, dorsum sellae, which are the bony part, but in between these two you will have a dural stretching, which is known as diaphragma sellae, because it is acting like a diaphragm. So this diaphragma sellae is the extension between the tuberculum sellae anterior to the your dorsum sellae posterior. So it is a dural fold. What is that? It is made up of dura matter. So it is a dural fold. It makes the dural fold. Here you can see that this is a dural fold. Now this is a extension, or it is a stretching which anteriorly attached to the tuberculum sellae, and posteriorly it is attached to the upper margin of dorsum sellae. So this is the dorsum sellae, and this is your anteriorly tuberculum sellae. So here in this video clip you can see that this is a diaphragmatic fold, or you can say extension of the dura mater. Now if you will remove it posteriorly, you can see this is the upper margin of dorsum sellae, and this is your tuberculum sellae. So the inner side is attached to this sellae. Clear? So if you will see from the side, it is covering this pituitary fossa from above. So deep to this diaphragma sellae, what you will have? Deep to this sellae will have this space which is known as, what is that? Hypophyseal fossa. So above the hypophyseal fossa, this is making a roof, and this fold is attached between the diaphragma sella and tuberculum sellae. Now there is one more term I told you in the midline, most posteriorly is the clivus. So when you will go from anterior to posterior, so this is our Jugum Sphenoidale, then you will have this sulcus chiasmaticus, then you will have Sella Turcica, which is having 3 components, tuberculum sellae, hypophyseal fossa and dorsum sellae. Now this dorsum sellae is a bony plate. So this plate anteriorly contributing in the posterior wall of the hypophyseal fossa, and posterior part of this bony plate is continue with this basi occiput. So this slope which is visible here is known as clivus. but this clivus is contributed by the two bones, anteriorly sphenoid, posteriorly occiput. So this portion, this sloping backward area is known as clivus. So what is clivus? Posterior surface of dorsum sellae slopes backward, and this continue with the basi occiput to form the complete clivus. And if we'll talk about this clivus part of your sphenoid bone, it is related with the upper part of bones. Clear? So now we'll just revise this. Now this is your skull. Now in this skull, from anterior to posterior, what we have discussed is that this is your part of posterior wing of posterior part of the lesser wing, and this is the area of Jugum Sphenoidale. Here will comes is your sulcus chiasmaticus. This will be your pituitary fossa. So behind the pituitary fossa, this will become your dorsum sellae. There is a point is known as posterior clinoid process. This is foramen magnum. So this area is become clivus, and anteriorly here you will find the tuberculum sellae, and tuberculum sellae to dorsum you will have a diaphragmatic structure is known as diaphragma sellae, which is formed by the dura mater. Clear? So now at the end of this session, I hope you are able to first understand that what are the parts of the sphenoid bone. Then when you are seeing the superior surface of the sphenoid, basically you are seeing the bone from inner side, and that means we are talking about the floor of your cranial cavity, and the sphenoid bone contributes into the anterior as well as middle cranial fossa. Clear? And what are the structures you will see in the through the floor in midline are important. So this is all for today's session. Thank you.